All right, I'll declare a quorum and call. We have a posted budget workshop meeting. Just time set a meeting to follow in our regular commissioner court meeting, so I will declare a quorum, call that meeting to order. We have one item discussion regarding the 2022-23 budget.
So I really don't have much for you again. We did get our initial tax rate calculation worksheets in. Our no new revenue rate gone down to 0.53. No new revenue rate is gone down. Total rate of 8.45131. Our voter approval rate, which is to get there, we have to have the election for 8875. Voter flood rate.
No new revenue.
0.45131. Flood rate was 0.07079. I've tried to do some backtracking on the calendar so that we can have everything done in the timeline that it's supposed to be done by. And it looks like we should have everything ready to have a budget posted by August 20th. Yes, we want to be able to publish our proposed budget not on the street, and then do our publishing on our salaries and our tax rate hearings and our budget hearings all by the Sunday paper, August 28th. This gives us enough time to have everything approved by our last court date in September, our last regular court date in September 19th.
6 weeks, 7 weeks.
Yes. So we are still waiting on some of the departments to get us their budget request in, so we don't have everybody's budget request yet. I'm getting those in. Gary asked if I had said anything to them about pay raises or whatnot, and we didn't. We just sent them out like we normally done, and I figured they'll ask, like they usually do, whatever the county's gonna get, so, that's again, you know, so far what we've seen, the ones that usually ask for special pay raises, we haven't seen anything like that. So, I
That's
don't,
the last thing.
yeah.
That's the second.
Oh, okay, so it gives us the,
That gives you another one.
yeah, it gives us another week, so we should, so. Take on my timeline. So far, that's what I have for you, which is a whole lot, not much.
I'd just like to remind all the department heads and elected officials that what we want to see, I think what I want to see anyway, is everything except salaries. And we'll deal with salaries all at one time. And we just need, what I would like to see is just what it takes to run the office. And then we'll deal with salaries at the end.
Yeah, we don't need to know what everybody wants.
Okay,
Yeah.
so when we're running initial budget numbers, normally what we do is we just put in what it was last year, what that looks like based on our current tax rate, and we'll be able to have some those.
Current tax rate, we get on the tax rate, extra revenue, we're gonna get right.
You had any special requests you said at all yet?
No, not for salaries, no, sir.
But you have.
It's a bad time, especially. Yes, submitted
Okay, I haven't seen yours
special
yet.
salary request.
Okay, so other than the sheriff.
Well,
Sorry,
we
haven't
have,
seen yours yet, sorry.
So Dion is here from Center for Life, as you know, and he requested to see this budget while he's here, if y'all okay with that.
No idea. Hi, Herman, I wasn't sure. Well, good morning again, deja vu. I got some handouts right quick, it's just the same information that I usually hand out, so y'all can see how many folks are actually serving. I'm not sure, I have enough copies, I think, I have a few extra. It's 2 pages this year, it's normally 1 page. I'll make sure y'all have a copy before I start going over some of the numbers, because there's a pretty significant increase, which isn't good. Yeah. Okay, well, here's the numbers for the last 12 months. And the first thing I want to bring your attention to is our 100, the very first line is intake unit. So those are folks who are calling for services for the first time. So they might be have depression, they might be have a loved one who has a diagnosis of mental retardation, they might be calling for a friend. And so we had 800 intake screenings during the year, which is huge increase from the previous years. The only exception might be that first year of COVID, when it was really, really bad and everything was shut down. So we have 800 folks in intake, and if you go down to where it says MH Med Clinic, number 380, it's about a quarter way down the page. We have 630 folks from within the county who are going to see our psychiatrists, seeing our nurses, they're getting services in our clinic. So we have a huge increase in the total number of served. Our total number of served for the last year is 2,291 individuals. So whenever you, and on the math on the bottom of your sheet, it shows $5,200, which is our request of the funds, which we greatly appreciate so much. Because for every dollar, every 60 cents, for every 40 cents, I can turn that around to match and pull down another 60 cents from the federal government. So that's $2.27 per person on average. And that's a really, really good deal for the county. But we're going through a lot of changes right now with managed care companies and changing the way. And then at the same time, like unfortunately with the Uvalde shooting that happened a while back, within not even 24 hours, I received a phone call from the center there, MHMR center there, because they were asking if we would be on standby to go and provide counseling because it's such a traumatic event. And I know I'll be at the Capitol at the end of this month, and there's gonna be a lot of discussion around that. And it's frustrating for me because a lot of times we're just reacting to stuff instead of being proactive and trying to stop stuff from happening. So I would greatly appreciate your consideration and continuing, at the minimum, continuing the same amount that you have given in the past. However, if you do have like any of the COVID money, ARPA money, if you have any, because we are considered first responders, because we do, we're a lot of times we're with Vance, and we work hand in hand with Vance and his awesome team, and also the chief of police, and so greatly appreciate it. I don't want to spend too much of your time going over numbers, but and CCCT, which formerly was Family Service Center, we took that over, and to provide, because we want to make sure those services are being provided still in the community, anger management, safe exchange. If you have a divorced couple and they don't get along, it's a safe place to hand over the child to the other one. Yeah, and I would greatly appreciate any consideration, but y'all know me, I totally understand how, I was at the Comanche County last week, and I told them the same thing I told y'all, is I understand that a lot what the state's doing is they're just pushing down the cost to the county. So everything has an expense, and it doesn't just go away. And so I'm very aware of that, and I'm very appreciative, because we're partners in helping our fellow Brown County residents. Seven counties.
What about, we were also helping you with vehicle or transportation?
Yes, Greg, we got that car, it's for transports to the hospitals, which we have not used our allocated state beds in at least 7 years, because they're full. They stay full, so as a result, we're having to use private psychiatric hospitals, and a lot of times they're full, so we end up having to transport all the way to El Paso, to Wichita Falls, with their mental health deputies, which are wonderful. And there's been a few times where we get down there and then the hospital won't take them. And then we have to drive back, and then there's all kinds of stuff that happens. In the meantime, we got someone who's either danger himself or danger other, someone else, families crying, upset, so, yeah, it's a challenge, but it's rewarding, and y'all are a big part of that, seriously, honestly.
You gotta go to all these 7 counties.
Yes, sir. Yes, sir. Is there any questions?
What were you asking the county for this year?
The same amount, I think it was 5,200, and I think CCCT had an additional, I think total was 12,000 between the two. And we also get 50,000, because this is the only county we do it, but we transport, we have like a stand, and then we have our mental health deputies help as well.
Right.
And that money helps for that, fuel, which then y'all are aware of the inflation.
So you're asking for the same amount?
Same amount, but if you get any ARPA money, I would ask if you consideration of giving some of that funds to help us.
What is your biggest need in your transportation or in your,
It's in
or
service,
this number out here, or any of all of it?
all of it, services, actual services, and right now we're about 20 employees short. Because we can't find anyone to work. And so when we're fully staffed, we have about 240 employees. We have, as of Friday, we have 23 openings. And so, and that's hard because then the folks who are there, we don't want to burn them out. But what we do is very hard. It's very emotional and stuff. So any consideration whenever that time comes. So I'm just very appreciative for y'all working with us like you have over all these years.
Thank you, Ian.
All right, thank you. And I don't know, did you want to do the Brown County Museum? I don't know if there was.
While you're here.
Yeah, because she's here, and so we don't got anybody to.
You ready?
Yeah, so it'll be real brief over here. So I'm gonna take off my hat of MHMR, Center for Health Research, and put on the museum. And Kendall's our new director there. She's done an outstanding job. She's also a professor at Colleton. Wonderful job. I don't know if y'all been in the museum lately, but it's just, we've done so many wonderful things. We had Dino Days the other day, had 60, 70 kids going through there.
We got 400 people total.
They go through, yeah. And so the wonderful, so the museum is probably, in the whole time I've been affiliated with it, we're seeing a lot more people. Folks are wanting to get out. And I always, I've said this so many times with y'all, but cell phones seem to take the place of actual things. And I think now is a more important time than ever that children learn through actually seeing like World War II stuff and the Native American stuff. They need to actually see it and not just read about it on the phone. And we're very fortunate that we have our museum here, and then the courthouse is in need of a lot of repair. We got some on the back end, I said the jail. the old jail. In the back end, there's some windows that have busted out and termites, fine termites and stuff, and so, and we do want to take care of that jail because it's a lot of Brown County history. A lot of folks really, I mean, it's like everybody recognizes that building here in town because it looks like a castle. So I'm gonna stop talking and let Kendall kind of say a few words.
So what we have, budget request for this year is going to be 59,000 that we're asking. Now, I know that's a lot, that's a bigger increase than what we had from previous years. But specifically what we're looking at doing with this amount is to try to fully staff 2 full-time employees. With our the different grants and things that we apply for, those goes to specific programs that we can offer for educational purposes, and to keep costs down for admission into the museum. They don't necessarily cover, employees and kind of the general kind of upkeep of the museum. It's always specifically allocated for those different programs and, opportunities that we kind of provide for the community. So that's kind of what our budget request is. Last year we received 18, a little over 18,000 for it. Part of that, though, 5,000 of it was allocated from the previous year. We just didn't get those funds until last year. And then some of it was the APR.
Well, yeah, there's some money left
That was
over.
the first round of the COVID grants.
Yeah.
So that's kind of where some of that money has
Not,
come
not
from.
the art program, there was the program before, I think it was called the COVID.
Yeah.
In the historic jail building, is that not something that we've actually kind of paid for out of our maintenance funds too from time to time? I don't recall.
Yes.
We have, Pat's not in here, but we've gotten insurance to do all, we're willing to do all the buildings, so that's the bid in going there, so any repairs from here on out, they're gonna be on us.
On the
The
historic,
old jail.
the old jail.
Any other questions?
Thank you.
Thank you.
Thank you, I appreciate it.
Art, did you need to talk to us?
Yeah, just real quick, briefly.
That is our request.
Nature of the beast, Lord.
Morning. We have a renewal of our group life program. So it's a basic life program, voluntary life, if the employees so choose to pick that, and a dental plan.
Did we have a dental plan last year?
Yes. And so, starting with dental, there's no rate increase for dental. It stays the same rate. Everything stays the same on that. The voluntary life, this is the rates that the employee would choose to pay if he or she decides to buy more life insurance than the county provides. The county provides $20,000 flat now. We have 32 people currently trying to get that up more on voluntary life, to buy more than the county provides 20. They can buy up to $100,000 guaranteed issue. So if you had cancer and you wanted a $100,000 policy, you can get that under this program, or any kind of pre-existing, if you know what I mean. The basic life that the county pays, we hadn't had a rate increase, and I were talking this week, I think it's 1996, but it's going to be $1.05 per month per kid, which equates to about $185 a month, 176 on the plan. $1.05. So actually,
Basic.
that's the basic $20,000 life and AD&D, which is accidental death and dismemberment, which is double the 20. You know, 176 people so far. Basically, it boils down to 5.5 cents increase per thousand of coverage. And that's $1.05 per month per employee. We paid out $70,000 in death claims this year, which is about 3 times more than what we pay in premium, more than that really. Our average age, and we've talked about this on the health side, is going up. We now have 5 more employees moved to the age 70 plus bracket on this program. So older people drive your rates up. I mean, that's just, they're closer to death than the younger guys are, or gals. So, just want you to know that's forthcoming. And, it's a very minimal rate increase, great program with Sun Life. And, any questions?
Do you have an effective date for that to start?
October 1st.
Questions for Bart?
Bart and I were talking earlier, so right now we pay $8.20 per person and per month, and with the increase, it'll be $9.25 per person per month. So it's just a $1.05 increase. And, it has never increased since I've been here.
And the main reason for the increase is the older age, and we did pay out 70,000 death benefit. And we're pooled with a bunch of groups our size, so we don't get hit completely. You know, we're paying 18,000 a year in premium, and we're paying out 70,000 claims. That's a big difference. So they didn't just knock our head off. I mean, $1.05 per employee wasn't bad at all.
Thank you.
Thank you. Thanks, Ann.
Did we ever hear what our rebate was gonna be? You talked about there would be very little rebate from.
Suppose I hear something this week, hopefully.
Okay.
I wouldn't count on a lot,
I
but,
knew that.
Is that from Blue Cross?
uh-huh.
It's a little over
I was
13,000.
thinking 12.5, something like that. So
You already heard?
I'm gonna get the exact figure and I'll get it back to y'all, and I'll talk here in just a minute. Yeah.
Do we have anything else on the budget? We'll have another budget meeting on the 8th, following our regular scheduled meeting.
I've got vehicles and equipment and stuff that I need to present at some point, if y'all are
Well,
willing
I'm
to
sorry, I
listen.
didn't know you wanted to speak to us today.
Yeah, ordinarily we get a deal, you know, where we're scheduled a time, and I haven't received
Well, I
anything.
was gonna ask, we need to set up a schedule for those.
Yeah, we hadn't got that far yet.
I prepared packets for all y'all, I don't know if y'all received them, so, just checking, I don't know.
We need to set up a schedule for those that want to come speak to us for this next week.
When they turn it in, they let us know if they're wanting to speak, but we're not to that point.
Yeah, we just now got our numbers. We haven't even had a chance to digest them yet, Sheriff, so we don't really, hadn't had a chance to get a whole larger picture of what we're looking at yet.
Okay, just checking, thank y'all.
We know you have a need.
So we'll have to schedule that a week ahead, so we get started, we have to figure out.
Yeah,
take
we
2 or
can
3
get that
days.
figured out this week, and then we can try to schedule something next week. It's just a matter of.
You could spend 2 or 3 days in 1 week,
Yeah.
just to listen to people, what they want to come present to us, so. And we offered up in some takes, some double takes.
I don't need 5 minutes.
5 minutes. I hadn't received your packet, though. I haven't seen that.
I hadn't seen
No, I
that.
haven't seen, I haven't seen what Don King said, he said it's either on that veteran land board.
I hadn't
seen
received a packet yet either.
I didn't see it.
It's,
In our emails?
Okay, that being said, we want to meet again next week. Sheriff, can you be prepared to come talk to us then?
Anytime you're ready.
And we're adjourned. Thank you.